Hello, everybody. This is Gary. Today is Tuesday, March 7th, 2023, and this is my coping with schizophrenia blog entry for today. Today, I'm not doing too bad. I did my physical therapy exercises and walking, and I went to the Walgreens to pick up my prescriptions. I had an appointment yesterday that I didn't keep because I wasn't feeling very good. It was an appointment with my peer support specialist at my mental health clinic, and I couldn't make it in. I felt really paranoid, really anxious, hallucinating. I didn't have to go to the psychiatric emergency room, but for the past couple of days, not today, I was feeling so paranoid that I didn't want to leave my apartment. So I didn't. Today's the first day I went out in about 2 days, more than 48 hours. Today, my paranoia is not that bad. My delusions are not that bad. My auditory hallucinations are at a bare minimum. My anxiety levels are pretty low. Had a bit of insomnia last night. I was up most of the night, although I didn't actually get out of bed. I woke up around 2. I may have drifted in and out of sleep until about 5 in the morning when I finally did get up and take a shower and took my morning meds. I did my morning meditation. I did my afternoon meditation, and I will do meditation later tonight. I use YouTube videos for meditation. Some of the ones that I use are from hypnotherapists like Jason Stevenson, Michael Seeley, Tansy Forrest, Christian Thomas, Meditation Vacation, Michelle Sanctuary, um, and a few others. I like Michael Seeley the best. But of course, meditation doesn't treat psychosis, but it does help reduce my overall fear and levels of anxiety, um, in addition to my medications. Um, I had an endoscopy scheduled for this upcoming Friday, but I decided to cancel it. I really don't feel like having a camera shoved down my throat and being drugged up for 3 hours, so I canceled it and I didn't reschedule it. The point of the endoscopy was to dilate my esophagus so food would get stuck in my esophagus. But instead of doing that, I'm gonna try to just chew my food better and more slowly and stop swallowing large bits of food so they don't get stuck in my esophagus. I really don't feel like lying on a fucking table this Friday having a camera shoved down my throat when I'm half drugged, half asleep, half awake while they're doing all of this to me. Um, I don't think this problem needs to be solved that way. It's just a matter of how I eat my food. But The swallowing problem began originally when I first started Seroquel. I think Seroquel is known to cause difficulties in swallowing and interferes with the smooth muscles of the esophagus. I do have a hernia in my esophagus, but the gastroenterologist said that doesn't need to be corrected. It's not the same kind of hernia you would get in your groin or your abdomen that needs to be corrected surgically, um, which I've had before. I've had surgery on my hernias in my abdomen. Um, but overall, my psychiatric symptoms are under control today. Not much to complain about. Um, just finished cooking dinner and I'm waiting for it to cool down. So that's all for now. Like, comment, share, subscribe.